Good afternoon to everybody in the room, and good afternoon, good morning to those of you in Western time zones, for those of you who are joining us virtually, and thanks to everybody in all places for your patience as we get going on a day when somehow the internet is giving us some shakes here in HHS, but we are glad to have everybody here together. My name is John Balbus. I'm the Acting Director of the Office of Climate Change and Health Equity, and it's really my pleasure to be able to welcome you and get us going, and to have us all here for this Strengthening Partnerships for Healthy, Climate Resilient, and Thriving Communities meeting. I want to start by just thanking all of our partners, those of you in the room, all the community organizations, our professional societies, and especially our non-governmental partners for being with us today. Of course, we're meeting today in the midst of a summer of unprecedented climate change-related disruption with record-setting heat, devastating storms, widespread wildfires. We're seeing unfold in real time, pretty much every day, every week, how climate change is fundamentally a public health issue with health harms that interact with and exacerbate underlying social and environmental drivers of health disparities. And so even as all of us are affected, we are all affected, frightened, some of us, depressed, some of us made ill by the extreme weather events that are occurring this summer. We know that those bearing the greatest burden of suffering are the communities that also bear the greatest burden of health disparities and that bore the brunt of the COVID pandemic, our low-income and indigenous communities, some communities of color, those within our communities that are most at risk and disenfranchised, including people experiencing homelessness, people living with disabilities, people living with severe mental illness. In establishing the Office of Climate Change and Health Equity with the mission of protecting the health of those most vulnerable from the impacts of climate change 2 years ago, we recognized the need to reach to the local level and that we would need strong partnerships, especially with the HHS regional offices, to build on their existing and trusting relationships with the affected communities. And so this meeting here today represents the culmination of nearly 2 years of planning and joint activities of another smaller but really important partnership, that between our Offices of Climate Change and Health Equity and the Regional Health Operations Office under the Assistant Secretary for Health, the Office of Human Services, Emergency Preparedness and Response in the Administration for Children and Families, and the Office of the Assistant Secretary for Policy and Evaluation. Now that's a mouthful. I didn't give you the acronyms. Even just the names are hard. And that's why we're starting here today with our Assistant Secretaries representing these offices. This partnership is significant and symbolic, both because it formalizes a close partnership between a new federal government headquarters office and existing regional infrastructure, but also, and really importantly, it represents a growing connection between the healthcare and public health side of HHS, the Department of Health and Human Services, and the Human Services side. And so I want to make sure I express my gratitude to our partners at now ORHO, Regional Health Office Operations, ACF and ASPE, and the leadership of our offices that we have here on stage. We started with a series of 14 community conversations across the country to learn from frontline perspectives about the intersection and the interactions between climate change, other social and environmental factors, and health disparities, and what were the frontline needs related to building climate resilience at the community level. And now we're coming together today to take those learnings and a broader set of perspectives from partner organizations and national experts and forge ways to improve coordination and effectiveness of our federal efforts to protect communities at greatest risk of health harms from climate change. So today we'll have presentations and discussions on key themes and lessons learned. Tomorrow our federal participants will build on what we learned today to pivot to action steps with a focus on regional coordination. We appreciate partnership from colleagues both within HHS and beyond, knowing that protecting health should be foundational for climate resilience activities across the whole of government. I want to emphasize that while this meeting is the culmination of a 2-year process, it's also just the start of ongoing strengthening partnerships, both among the federal agencies working on community resilience and between the federal agencies and the state, local, tribal, territorial, and community-based organizations that are really on the ground doing the work. We know the coordination between federal partners and with non-governmental partners is going to be critical to addressing frontline communities' climate resilience needs. And so once again, we are very grateful for all of your presence and participation today and tomorrow. And now, it's my distinct pleasure and privilege to introduce you to our distinguished HHS leadership who have joined us today. I'm going to introduce them in the reverse order that they'll be speaking. So first I'll introduce Miranda Lynch-Smith, who is the Deputy Assistant Secretary for Human Services Policy and also has the title of Senior Official performing the duties of the Assistant Secretary for Planning and Evaluation. Miranda Lynch-Smith was appointed the Deputy Assistant Secretary for Human Services Policy in 2021. Prior to joining the Biden administration, she was a policy fellow at Chapin Hall at the University of Chicago. And prior to that, Miranda had a 20-year career at HHS. She was at the Children's Bureau, where she was responsible for leading the Child and Family Service Review process and had key responsibilities for developing and analyzing federal and state legislation, regulations, and policy related to child welfare and human services program. Miranda received her bachelor's degree from Douglas College and her master's degree from the Blaustein School of Planning and Public Policy, both at Rutgers University. Our second speaker in the middle will be January Contreras, the Assistant Secretary for the Administration, or the Administrator for the Administration for Children and Families. In her role, she works under the leadership of HHS Secretary Javier Becerra to strengthen the well-being of the nation's children and families with a focus on prevention, safety, economic stability, and equity. Throughout her career, she's been motivated by a sense of duty to children, families, and individuals. January previously served at the U.S. Department of Homeland Security and as a designee to the White House Council on Women and Girls, and at the state level in the Arizona Department of Health Services. She's a former deputy county attorney and assistant attorney general. She earned a bachelor's degree and JD degree from the University of Arizona, and she and her husband of 28 years are the grateful parents of 2 adult sons. Our first speaker, and let me come back around. Our first speaker will, of course, be Admiral Rachel Levine, who serves as the 17th Assistant Secretary for Health for the Department of Health and Human Services, after being nominated by President Joe Biden and confirmed by the U.S. Senate in 2021. As Assistant Secretary for Health, Admiral Levine fights every day to improve the health and well-being of all Americans. She's working to help our nation overcome the COVID-19 pandemic and to build a strong foundation for a healthier future, one in which every American can attain their full health potential. Admiral Levine is also the head of the U.S. Public Health Service Commission Corps, one of the 8 uniformed services. After graduating Harvard College and the Tulane University School of Medicine, Admiral Levine completed her training in pediatrics and adolescent medicine at the Mount Sinai Medical Center in New York City. And among her many posts, she has served as professor of pediatrics and psychiatry at the Penn State College of Medicine and chief of the Division of Adolescent Medicine and Eating Disorders at the Penn State Hershey Medical Center. She served as Pennsylvania's Physician General and as Pennsylvania's Secretary of Health, and she's been an outstanding champion for our work on climate change and community resilience since starting in her job. So let me turn the podium to you, Admiral Levine.
Well, thank you, John, for that introduction, and it's wonderful to be with my friends and colleagues here on this panel. And so welcome to the Strengthening Partnerships for Healthy, Climate Resilient, and Thriving Communities Summit, and it's a real pleasure to join you today. We have hundreds of participants online. Hopefully the internet is working. And in the room, of course, joining us from everywhere from Maryland to Alaska, which is where I'm headed on Saturday, and everywhere in between. And we want to especially thank the individuals who participated in the community conversations leading up to this summit. Your knowledge, expertise, and local leadership is invaluable in advancing meaningful action. Climate change is impacting the health of people all across the country and all across the world right now. The health impacts of climate change are significant and far-reaching. We're seeing alarming levels of heat-related illnesses, respiratory and heart disease, changing patterns of infectious diseases, and risks to pregnancy, birth outcomes, and also risks to mental health. Climate change can lead to population displacement, supply chain disruptions, decreased water and food quality and availability, and interruptions to health care delivery. Climate change also impacts mental health, with adolescents and young adults suffering the most. The health impacts of climate change are not equally distributed. In addition to disproportionately affecting children, these effects interact with systemic economic and social inequities and exacerbate existing health disparities. We know that crises don't wait their turn, and we have seen this extreme weather undermine access to needed care through the COVID-19 pandemic and more. So we need to take action right now to create a healthier future for ourselves and certainly a healthier future for our children and their children. And we need to work together to do that. That's why partnerships is probably the theme of this conference. This includes centering health and health equity in our efforts to curb climate change and to mitigate its effects on our communities. And we can do this. We can do this, in part by building resiliency and sustainability in the health and human services sector. We can prepare now for the changes that we expect in the future and that we know are coming in the future. We can plan ahead to ensure health care services remain available even as climate change continues to impact our health and our quality of life. Addressing the impacts of climate change on health and health equity is a priority for the Biden-Harris administration and for our Secretary Becerra. Through the efforts of our Office of Climate Change and Health Equity, just 2 years old, and other HHS agencies working in partnership, we have made significant strides in raising awareness about the threats that climate change present to the health of vulnerable populations in the United States and throughout the world. We have introduced informational resources and supports to help communities and care providers to accelerate their work on preparedness and mitigation. I would like to share several notable examples of our progress. The creation of the HHS Office of Environmental Justice, two sides of the same coin, our Office of Climate Change and Health Equity and our Office of Environmental Justice, which focuses on protecting disadvantaged communities and vulnerable populations who directly face health risks from pollution and other environmental hazards every day. The expansion of the Low-Income Home Energy Assistance Program, or LIHEAP, which provides funds for cooling assistance to eligible low-income households. The introduction of supports to states and cities to protect at-risk populations from climate impacts, and the mobilization of more than 100 organizations, including providers, suppliers, and insurers, to join the White House HHS Health Sector Pledge and work to become more resilient about the impacts of climate change and also to actually work to decarbonize and support surrounding communities. We need look no further than the troubling events this summer in terms of heat, but also air quality on the East Coast, to understand that we need to accelerate our efforts. We have experienced relentless combination of extreme heat, drought, wildfires, flooding, and high-powered storms that have harmed tens of thousands, spread numerous illnesses, and exacerbated chronic health conditions. The groups bearing the brunt of this are the same that bore the brunt of the pandemic: the poor, vulnerable, and marginalized communities. They often live near heavily polluted sites. They have limited access to health services, and they also bear the burden of chronic health conditions. The bottom line is that acting on climate is a public health imperative, and effective actions must address the health needs of frontline communities. For all of these reasons and more, we decided to hold this summit right now, which you are part of here today. We are convened today to develop stronger collaborations and coordination among federal and non-federal health and human service partners. We have an opportunity to engage and address the impacts of climate change on the communities that we all serve. This summit serves as a space to discuss key insights from those engagements and to identify interdisciplinary opportunities to address the needs identified in those discussions. Over the next 2 days, you will hear from academic leaders, national associations, regional administrators, and federal experts, and I encourage everyone to work with us to help us leverage relationships across agencies and within regions to strengthen our climate and health response. We certainly cannot do this alone. This has been a great collaborative effort across HHS, and I want to thank all of their staff for their expert planning and execution for these community conversations. So thank you so much. It's an honor to be here, and I will now turn things over to Assistant Secretary January Contreras. Thank you.
Good afternoon, and thanks for the chance to be here today. Also very glad to be with colleagues who I respect, and we're getting a lot of good work done. This is just one example of that. But I'm glad to be here with all of you, and thank you for what you've done so far, because I know if you're in this room, it means you're already doing work somewhere, whether that's with us as colleagues in the federal government, whether that's at a state level, a local level, or our community partners in nonprofit and private sector. So thank you for what you do, and I'm just so proud of our team in being a partner with OASH and ASPE to bring this work together. I am January Contreras. I have this incredible privilege of serving as the Administration for Children and Families Assistant Secretary. We have everything from Head Start to child care funding to child welfare to those safety programs and safety net, utility assistance, the Community Action Network funding, our emergency preparedness with our human service providers, refugee resettlement, all these things that we do that we know are happening in your communities, and that our partners there also need to be a part of these conversations. So we're glad that Human Services is included as a core of this work. As a native Arizonan, I will say that this is something that's very real and hits home in a very close and personal way. On the fun side, growing up, 4th of July, we didn't need a fire to make s'mores. We wrapped up our ingredients and we put them outside in aluminum foil. And the chocolate and the marshmallows melted. Right? Those are the fun sides of this. But as we get to these spaces where you're not getting a break from the heat, where homelessness and housing instability is on the rise, it's something that we look at, that we're constantly looking as individuals and communities. How do we play a role in this? And so this work to get ahead of it, where we're not just responding to the consequences of climate change, but also trying to look ahead at how are we developing policy, partnerships, collaboration that can make a difference and put us on a different trajectory. In leading this work with our partners here, as Admiral Levine mentioned, this is a part of driving the Biden-Harris commitment to building healthy, resilient, sustainable communities. Executive orders from the White House have urgently renewed our federal focus on climate change, on environmental justice, and importantly, racial equity. At ACF, like our partners, we recognize that all of these three areas come together. You can't take them apart, and I appreciated when Admiral Levine spoke about those being cores together. We know that with the greatest exposure of risk for climate change and environmentally related disasters, those are often hitting those with the fewest resources, those with the least ability on resources to adapt and to respond and to survive, let alone thrive, as we're talking here, in those events. The community conversations that were mentioned, so important. I had the privilege of being with our director of OSEFR, Natalie Grant, with tribal leaders. These are elected leaders of tribe. What we heard them speak of was, I think, more than I expected. Not just what is it like, which is very serious, when flooding cuts you off from the center of goods, when you no longer have access to that, but also things that interfere with their abilities to survive with the traditions that they are trying very desperately to hold on to. Fish no longer being available for them in their lands. So at ACF, this awareness has enabled our focus on initiatives at the community and individual level through what are the Justice 40 initiatives, and I hope many of you have heard about that, and if you haven't, if you go and Google the Justice 40 initiative program and the White House, You will find more information about that. At ACF, we have 5 Justice 40 programs that are managed through our Office of Community Services. Justice 40 seeks to deliver 40% of overall benefits from federal investments in climate and clean energy to marginalized and underserved communities. And when I think about that, I think about, again, how these all come together with environmental equity, with health, of my own family being moved twice for airport expansion. And knowing that so often it is communities of color, it is those poor communities that are bearing the brunt of what is happening. And so this call to action and coming together to create solutions is overdue, but so necessary. Justice 40 is an antidote, and this work is an antidote to the experiences of families like mine. The targeted investments support community and rural economic development, direct assistance to eligible households for energy and water bills, and they enable action at the community level through non-governmental service providers, some of whom I know are here today. We've also focused on how our human services partners are part of this work and bringing them to the table because they're so often a part of the response efforts in communities. So as that work happens, we're also keeping our ears open at ACF. We have a lot of our team here, and thanks to those who are helping to lead this and also who have volunteered to be here. We want to know what your ideas are, what your needs are, what your challenges are, where you see collaboration that may exist for us, our ACF partners. Because we know that you're essential. We don't do anything by ourselves. We only get it done with all of you. So before I close, I do want to offer my sincere thanks to the ACF team from OSEFR for creating space for human services programs, partners, and everyone else who's here to connect and dialogue about how we move forward and make a difference. I'm confident that this will be the first of many collaborative spaces with you and with my HHS colleagues, both from ASPE and from the Office of the Assistant Secretary for Health. And on that note, I will turn it over to my colleague, Deputy Assistant Secretary Miranda Lynch-Smith.
Good afternoon, everyone. Thank you so much to my colleagues, Assistant Secretary Contreras and Admiral Levine. Thank you so much for really framing the reason why we are here, the charge for us today, and encouraging us and giving us kind of the urgency to work together to really address this critical need of all of our communities. I'm Miranda Lynch-Smith. I am the Deputy Assistant Secretary for Human Services Policy in ASPE, as well as the senior official performing the duties of the ASPE. Thank you also to John Balbas for welcoming everyone to this important event. As everyone has stressed so far, in almost every state in the nation and across the globe, we're seeing in real time the urgency of these issues. And so we're really looking forward to hearing from our speakers today and learning from you all, and then really digging in concretely as a group into the critical areas of climate and environmental justice, climate change, and health equity, and the specific ways that HHS programs and services and those of our partners and communities and across government can best advance environmental and climate equity for the families and individuals we all serve. During this meeting, we'll work to build on the respective roles and strengths of each of our agencies and organizations to take on these urgent issues most effectively. This is and truly does need to be a whole of government effort, both across all federal agencies and in collaboration with states, with tribes, local and community partners, and with national and philanthropic collaborators. My office at ASPE focuses on research and evaluation, policy development, and collaboration. And we are strong partners with ACF, with OASH, and others around really addressing health equity, advancing equity in all of the spaces in which we work and seek to do good to the people we serve. We are fully committed to ensuring that the results of our work are actionable and can help us all better understand the risks facing the people HHS serves, and to then identify and advance potential strategies to mitigate those risks and support resilience. We are also committed to using community insights and research to address these complex issues so that we balance the need to understand with the urgent need to act, and make sure we are doing that really tailored to the voices and the perspectives of the people who are most impacted. We're currently taking several approaches in our work. In partnership, I'll just detail a few for you. I know we want to get to the meat of the conversation today, but we have been working well together as a HHS. ASPE has been collaborating with the Office of Head Start and the Urban Institute on development of a mapping tool that can tell us where Head Start children nationwide may be most exposed to an array of environmental and climate risks, and to use that data to then provide resources to help early childhood educators and others to address those risks. The tool and resource library will be rolled out this fall, and we're happy to share our learning from that project with others. Second, as has been mentioned earlier, and you'll hear more about shortly, OASH and ACF have been talking with the communities they serve to better understand and respond to the concerns and priorities as they identify them. ASPE is seeking to complement ACF's work with additional conversations among human service providers, participants, and others on the front lines of serving people. We want to make sure we're bringing systematic analysis to understand all of those perspectives of the various communities and partners to ensure that we're best using our resources, again, tailored to the concerns that people raise to us. Finally, ASPE is supporting the Expanding Climate Change and Health Data Infrastructure Project with the National Institute of Environmental Health Sciences. This effort will aggregate and evaluate data sources, methods, and other resources to create a climate change and health data ecosystem that can explore potential relationships between wildfire exposures and health outcomes. And that project is funded by the Secretary's Patient-Centered Outcomes Research Trust Fund. That's just a selection of the work that my office is undertaking in partnership with others. And we want to make sure that this event today and tomorrow will surface additional important questions for further exploration and action. We're all about, again, those actionable tools and data and resources so that we can really address the issues. So ASPE's focus, like this event today, bridges both health and human services and the ways they intersect in the lives of people we serve. This is crucially important because the challenges people face cannot be neatly boxed as either health factors or social and economic factors. They're interconnected, as you've heard already, and are definitely exacerbated by environmental and climate hazards that increasingly confront low-income communities and others on the front lines of the climate crisis. At the same time, we don't want to forget that communities have assets. We want to make sure that we're elevating the assets that individuals and communities have that can mitigate environmental and climate risks. We want to find ways that HHS can strengthen, leverage, and build on those assets. I'm especially excited about this event today because it's a collaboration of HHS's health and human services components, and because it does bring together the voices and perspectives from communities and lots of other organizations. My hope and belief are that together we will inform each other, we'll motivate each other, we'll share inspiring practices and models, and build new and enduring partnerships to help solve these pressing problems. And I hope we really challenge each other too, to do a little bit more than what we might think is possible, to dream a little bit bigger than perhaps what our current resources allow, so that we can continue to advance this thinking. Finally, I'd like to thank the team that organized the event, including Natalie Grant and her team in ACF, Pam Winston in my office, and our colleagues in OASH and the Office of Climate Change and Health Equity. And with that, I'll hand the microphone back to John Balbus to get us started with the first panel. Thank you so much.
Thank you so much, Assistant Secretaries Levine and Contreras and Deputy Assistant Secretary Lynch-Smith. And thank you for your inspirational words, your inspirational leadership every day. And as senior leaders, also recognizing you have places to be. So thank you, and one final round of applause for our HHS leadership.
Produced by the U.S. Department of Health and Human Services.